Hi everyone, happy first week of Women's Health Month. As we announced on Monday, this week's topic was urinary incontinence. So thank you to everybody who submitted questions to us. And I tried to go through and organize the questions so that they are kind of in an order that makes sense. So our first question that I want to start with is this one. Okay. The most basic definition is it's the loss of bladder control. So leaking urine no matter how hard that you try to hold it in. So to start with a little basic anatomy, I have a handy dandy drawing here. So your bladder is what urine is stored in, and then you have your urethra, which is what takes urine from the bladder to outside of your body. And then you have your sphincter here, which is what they're muscles that hold that urine in. So for normal bladder function, you have muscles that push down and kind of compress your bladder here, and then your sphincter muscles relax. And so as these are compressing, that downward movement of the urine, these relax here, and you get your flow of urine out of your urethra. When it comes to incontinence, you have your normal forces pushing down, and then when it gets to the sphincter muscles aren't strong enough to hold it in. And so this is pushing down, urine is flowing to the urethra, and there's nothing here stopping it. So no matter how hard that you try, these muscles just aren't strong enough to hold that urine back. And so that's why you're leaking. There are two types of incontinence that are the most common. The first one is stress incontinence. So this is actually the most common. It happens in younger women generally, but can happen to anyone. And what happens here is that you have excess stress. So think about coughing, sneezing, running, jumping. So normal stuff, but it puts stress on your bladder. And these green arrows represent that downward stress, pushing the urine down, and then you get to your sphincter muscles here, and they are not strong enough to hold back that urine. So that's why when you do a stressful motion, such as a cough, sneeze, run, jump, that kind of thing, you're leaking urine. Then there's urge incontinence. And so where stress incontinence is based on muscle strength or weakness, urge incontinence is more based on nerves. So with urge incontinence, this is a strong, sudden urge that you need to use the bathroom, and you just can't get there in time. And you get this urge super often, 8+ times a day. And what happens is even when you get to the bathroom, you don't urinate very much. So it's your body sending these signals, so signals from inside your bladder to your brain saying, we really need to go to the bathroom, we have to go to the bathroom right now, even though there's not very much urine in the bladder. And that's why when you get there, you don't go very much. This is sometimes called overactive bladder, and it's more common in older women in general, but again, it can happen to anyone. And you tend to see this one more with stuff like sleeping, drinking water, touching water, hearing water running. It'll kind of cue that signal to be sent to your brain that you have to go. Incontinence can be caused by multiple different things. There's not one single cause that leads to incontinence. With stress incontinence in general, it's going to be caused from pelvic floor muscle dysfunction. So whether those muscles are weak or they're overactive. Whereas urge incontinence is going to be caused from a nerve issue. So you have essentially overactive nerves sending that signal to your brain that your bladder is full when it's actually not. Common causes for these nerve or muscle issues include pregnancy, so that excess weight of the baby pushing downwards weakens those pelvic floor muscles, and then childbirth, so vaginal labor can weaken pelvic floor muscles, as can the incision from a C-section. Menopause, it's been found that lower hormone levels after menopause can weaken your urethra, which decreases your ability to hold in urine. Being overweight, this is kind of similar to the pregnancy, where it's just that excess pressure down on those pelvic floor muscles can weaken them. Constipation. So if you're chronically constipated, you have to strain and really bear down to go to the bathroom. And this pushing down can put that excess pressure and weight on those pelvic floor muscles, which will weaken them. Nerve damage. So that leads to those incorrect signals being sent, like we talked about. And this can result from childbirth, injury or trauma of some sort to the pelvic region. And then conditions such as diabetes or multiple sclerosis, which affect your nerves. Pelvic and abdominal surgery also can cause damage to this due to, again, we talked about that incision with a C-section. So any other type of abdominal surgeries or pelvic surgeries that include incisions can cause issues to the muscles and nerves. And also, just in general, core and hip muscle weakness. The muscles of our hips and our core and pelvic floor all share common attachments to one another. So therefore, when we have weak hips and core, it can affect our ability to contract our pelvic floor and can lead to incontinence. So pelvic floor muscles are the muscles that support the pelvic organs, and they span the bottom of the pelvis. So between your hips, you can kind of think of them as a hammock that support the bladder, the bowels, and the uterus. And your pelvic floor muscles help to control your bladder and bowel, and also control sexual function. So I have another handy dandy diagram. So this is what a healthy pelvic floor should look like. The best analogy I've ever heard is an upside down coffee can, the old fashioned coffee cans that have like the plastic lid. And so as excess stress starts to push down and weaken those muscles, it'll start to look more like this. And so you can kind of see the difference there. You can see those weakened, stretched out muscles from that excess stress downwards. And this is what leads to when we talk about a pelvic floor dysfunction. No, absolutely not. This can affect men as well, but it is just far more common in women. It's actually twice as common in women compared to men. This is because of reproductive events throughout women's lives, such as pregnancy, childbirth, menopause, all of that. It affects your bladder, urethra, and the muscles that support these organs. Also, the female urethra is actually shorter than the male's, so any weakness or damage to this area is just more likely to cause urinary incontinence because of that as well. Absolutely not. It is a common issue that women face after birth, definitely. But it is not normal, and it's not something that you just have to deal with for the rest of your life. There's a lot of stuff that you can do to actually treat this and help improve it. In general, if you're still experiencing urinary incontinence 6 weeks after childbirth, you should see your physician or pelvic health physical therapist to address the issue. This is very common, actually. In general, we think that there has to be some sort of trauma, such as childbirth, surgery, that causes issues. But there's also, as we talked about earlier, multiple reasons that don't include those that can lead to urinary incontinence. A really common issue that just kind of happens in general over time is core weakness. So when your core, which involves your abdominal muscles and your low back muscles, become weak, this causes excess strain on those pelvic floor muscles, as we kind of showed with that diagram. Over time, this results in the weakness of those muscles, and they're no longer to support those pelvic organs and contract and hold that urine in like they should be able to. This results in what we call the dysfunction, and it's very common, and it's very commonly a cause for urinary incontinence. You can see your primary care physician for this, or your OBGYN initially, but they are likely going to refer you to a urologist or to a pelvic health physical therapist to treat this problem. And actually, depending on the state that you live in, you are likely able to go directly to a physical therapist without a referral from your physician. This is what we call direct access. It is available here in Kansas. And just make sure that when you are looking for a physical therapist, that you look for one who specializes or works specifically with pelvic health patients. But in the meantime, some stuff that you can try to do at home. For stress incontinence, so those weak muscles, you can try working on Kegel exercises. You can find those online, or you can contact us about those. For that urge incontinence, so the overactive bladder, you can try training your bladder. So what this would look like is going to the bathroom at set times. So start by tracking how often you go to the bathroom each day, or you have that urge to go to the bathroom each day. And then slowly add about 15 minutes between your bathroom visits. So you're trying to spread them out, trying to train yourself to hold that a little bit longer. And try to urinate every time that you go to the bathroom, even if you don't necessarily have the urge once you get there. And by gradually increasing that time in between, you're just going to kind of retrain your bladder and those signals being sent out to be able to hold it longer and longer. Another thing would be losing weight. As we talked about, that excess weight down on those pelvic floor muscles continues to weaken them. So less weight pushing down is going to cause, less stress on those muscles. And then changing your eating habits. So drinking drinks with caffeine, carbonation, or alcohol can actually lead to bladder leakage or urinary incontinence. Quitting smoking, just like a lot of other health problems, quitting smoking can actually help improve urinary incontinence as well. And then treating constipation. So your doctor may recommend to eat more fiber, since constipation, that bearing down that we talked about, weakening of those pelvic floor muscles, can make urinary incontinence worse. Just kind of off the top of my head, some foods that are good sources of fiber are going to be fruits such as bananas, apples, or raspberries, dark colored vegetables. So think about your broccoli, your greens, your carrots, beets, that kind of stuff, beans, whole grains, and potatoes. Not necessarily. While Kegels can help with the certain type of pelvic floor dysfunction, the muscle weakness, so our stress incontinence, some women actually have urinary incontinence because the pelvic floor muscles are always tightened. They're always just super stressed, essentially. And Kegel exercises will actually make this worse. And so that's why it's best to actually just see a pelvic health physical therapist who can address and identify which type of dysfunction that you have. So whether the stress incontinence, the urge incontinence, or maybe even a combination of the two. And they can give you specific exercises that are going to be best for you and not just kind of general ones that you can find on the internet. All right, that wraps up all the questions that I received for week 1. Thank you everybody who watched and who submitted questions to us and helped us celebrate week 1 of Women's Health Month. Stay tuned. Our new topic will be released Monday, and I'm going to leave you guys with a fun little quote about pelvic health and to help celebrate women.